Okay, good morning, guys. It is 8:30 for my 8:30 session. We'll be talking about cardiovascular system or the circulatory system and its diseases. So, just waiting for a few people to come on in. Good morning. Just typing a little message here to you guys. Thanks for tuning in. Okay, this will be for the morning session here. All right. If you have any questions, hi, Sam. Thanks for tuning in. How are you today, this morning? Hopefully, you're doing well. Just give a few more minutes. I only have about 3 people in here right now. We're going to talk about good. I'm glad you're doing good. I'm going to talk about your project and talk about circulatory illnesses or disease, or at least give you some ideas on a few illnesses here as I present some. Good. I'm glad you're doing great. All right, so I'll wait another minute or so to get started on today's lesson on circulatory illnesses. So just as a recap, for those that are in here, project is due Friday. You are drawing a diagram and labeling the heart. I put it out on Microsoft Teams, all right, on each one of those. So they're in there. Hi, Talon, how are you? Good to see you in here as well. Any questions that you may have? Project is due Friday. You're drawing a diagram of the heart, the parts that I went over with the vocabulary, what they do, and you're highlighting the parts of the heart that are flowing in on with the color red. Good morning, Kylie. Good to see you in here as well. And the part of the blood going away from the heart in blue. So with veins, probably make them a different color than the arteries. Remember, arteries go away from the body, veins go towards the heart. So for the pumping of the blood in the right and left ventricle and atrium. Okay. If you're finished, you could send it to me. Don't forget you have a brain pop as well as also due on Friday too. Okay. All right. Excellent. So if you have any questions on it, I'm going to talk about illnesses today to give you some ideas on cardiovascular illnesses and what they are and what they entail. So we'll talk about the treatments, talk about the symptoms, treatments, how long somebody may live, maybe some ways to help prevent getting some of these illnesses as well. So I'll kind of be going over some of that. Okay. All right. So I am going to get started with those that are in here. So I'm glad to see you guys in here on cardiovascular disease. Well, the first one is called that I have on my list is called congenital heart disease. It's also known as blue baby syndrome because people are usually born with this. So it could be caused by a heart valve defect and problems with the heart muscles. So congenital heart disease is a disease in newly born infants. So somebody was just born just like a baby. So that is a congenital heart disease. So some things that might happen, it occurs when the opening between the right and left atria or atrium or right and left ventricle remains open. So these openings could close soon after the birth. So the malfunction of the heart allows the mixing of the oxygen-rich and oxygen-poor blood. Remember, they had certain chambers for that. Okay, so this condition is indicated by a bluish tinge of the skin due to insufficient oxygen supply of oxygen for the for this young person that was born. Okay, for congenital heart disease. So this may be due to genetic disorders. Others may be may be caused by viral infections or pressure to certain chemicals during the early stages of pregnancy. Hi, Vero, how are you? Looks like we got you in here. We got Talon, we got Kylie, we got Sam Nestor. So thanks for tuning in. If you have any questions, you could type it on the bar on the live chat there about the project. I'm talking right now about circulatory illnesses. So if you could pay attention to some of these, might give you some ideas to do your research on. So the first one I just talked about was congenital heart disease. Somebody was born with it. The next one I'm going to talk about is called angina pectoris. All right, it's a rather long name for it, but it's really the narrowing of an artery as it narrows down. They call that atherosclerosis, okay, which leads to angina pectoris. So it's due to insufficient oxygen reaching the heart muscle caused by narrowing or the obstruction of the coronary artery. So this occurs in mid-age people or older people usually as someone gets older, okay, in their mid-age, probably 30, 40 and older. And a person experiences chest pains resulting in the feeling of tightness of breathing. So those are some symptoms somebody may feel with this disorder. Okay, and this is called angina pectoris. Well, another a narrowing of the artery, as they call it, atherosclerosis, which I'll talk more about atherosclerosis. They kind of go together in this one. This could be caused by emotional stress, but more likely due to physical activities that require an increased supply of blood to the heart. So, like I said, this the narrowing of the arteries that leads to this angina pectoris is the name of this. All right, so there's not a whole lot of information on that one. All right, Veryl, glad to see you're on here. Good, I'm doing fine. Thanks for asking. If you have any questions, you can ask at any time pertaining to the project or questions on the heart, circulatory system, and or these diseases that I'm going over for today, okay, or illnesses. The next one on my list is heart failure, okay? Well, somebody that has heart failure, this is the final stage, and it is in almost any type of heart stage is the failure or called congestive heart failure. This is where the heart muscles weaken and they're unable to pump enough blood to up to the body. So this is very serious condition. So if the left side of the heart is affected, the victim, the person that experienced it, will develop weakness, breathlessness, a cough with kind of like a saliva mucus like cough. If the right side of the heart is affected, the pain and pulsation in the liver and large veins and other symptoms are mistaken. Sometimes even appendicitis or gallbladder problems on the right side of the body, which we talked about when we did the digestive system there too. So early symptoms, if somebody has heart failure, some symptoms could be the weakness and lack of endurance. They usually get a pain in their leg as well, pains in their legs, soreness in the region of the liver or over the heart, sometimes palpitations and swelling in the ankles as well. Those are some things that could kind of happen with somebody that has heart failure. Okay, now I'm going to talk about some blood vessel diseases. This more so affects the blood vessels within the body. The other ones were kind of around the heart itself, and I'll be talking more on those. Any other questions so far? Okay, good. All right. All right, so some blood vessel diseases here. The first one is called an aneurysm. You may have heard of that one before. An aneurysm is a condition where the aorta of the heart and the arteries within the skull bulge during an increase in blood pressure. So the bulging occurs due to the weakening of the arterial walls. So the bulging of the arterial walls may be caused by injuries, infection, persistent high blood pressure, would be some types of so it's basically the bulging and the weakness of the arterial walls that's causing this discomfort and within the blood vessel itself. So symptoms for an aneurysm are usually slight shortness of breath, pain on exertion, like having you're doing a physical activity, you may feel some pain around different areas. It's located in if it's located in the arch of the aorta, the part of the heart. The symptoms include a cough, hoarseness of voice, chest pain, difficulty breathing, swelling in one arm, face, or neck. So that would be for an aneurysm. All right. All right. We got Kane in here too. Thanks, Kane, for checking in as well. Any questions that you may have, Kane, you can ask on any time on the live chat bar. Okay. All right. The next disorder that I have here on my list is hypertension, and that is also known as high blood pressure. Like I said, if many of you guys gone to the doctors before, put that cuff around your arm, they pump it up real tight, and it squeezes your bicep usually, and that's how they get a reading if you have high blood pressure or not. So it is because it's measured if it's higher than normal for high blood pressure. All right, so the systolic pressure is higher than 120 and the diastolic pressure is higher than 180, then is considered high blood pressure. So those numbers, 120 over 80 is actually a pretty good reading, a normal reading. So, but if that number is higher over 120 or higher over 80 on the lower end of it, then you most likely have high blood pressure. So hypertension is another name for it, and it develops when the body's blood vessels narrow, okay, causing the heart to pump harder. than normal to push blood through the narrow openings, okay, around the heart. Okay, so like I said, some numbers for somebody having high blood pressure. A normal reading, like I said, 120/80. If you're in a mild phase, stage one of hypertension, it's usually about 140 or 1 to 160, higher than that 120 number. And if your numbers is over 80 on your diastolic, your low number, that's usually between 90 and 100. That's a mild case of hypertension or high blood pressure. Moderate cases, if that number is about 160 to 180, you have moderate high blood pressure on the systolic, the higher number. And then if it's between 100 and 110, the lower number, the dystolic, that's still considered moderate. So if it's severe hypertension, it's higher than 180 or higher than 110 for the upper number at 180 and the lower number at 110. Okay. Any questions on maybe hypertension? Hi, Jasmine. So we got Jasmine in here now too. So good. Thanks for checking in. So I'm glad to see a lot of people in here this morning. So if you have any questions, it's time to ask. I'm talking about circulatory illnesses is what I'm going over right now with you guys. So just to help get you some ideas for your research side of the project. The first part is the diagram, which is the easier part, drawing and labeling. I put about 10 vocab words on Microsoft Teams with the flow of the heart, showing the blood. You could color it with the red color going towards the heart, blue going away from the heart, and then labeling the parts of the flow. You could probably find a diagram online. I know our book had a small diagram if you have the book at home. So those would be some ideas that you could have there for that. And in your research, I'm giving you some ideas for your research project here. Okay, for the circulatory illnesses. Kind of similar to what we did last week when we talked about respiratory illnesses with pneumonia and some of the other ones like that, cystic fibrosis. So these are ones that are pertaining to the to just circulatory systems, blood flow throughout the body. Okay. All right. Hi, Faith. Faith is in here. Vero, I don't need you asking who's all in here, so just kind of keep your conversations to yourself there too. So just ask me the questions. Don't worry about. I don't need anyone having side chats in here. So please just keep it to a minimum with that. Okay. All right. All right. Moving on from hypertension. Still some simple symptoms of hypertension. This is high blood pressure, dizziness, headache, ringing sensation in the ears. Okay. If hypertension is unrelated, it could lead to heart failure, even a stroke. Kidneys can have problems with that overall. So we didn't talk much on the kidneys, which is the excretory system. Okay. All right. The next, another type of circulatory illnesses is arteriosclerosis. All right. This is the hardening of the arteries. So it's a fundamental cause of coronary heart disease and the interruption of blood flow through arteries of the brain, which result to stroke. So the hardening of the arteries occur in most people as they become older. So that's a hardening of the arteries called arteriosclerosis. It's a rather long name to say. So the causes of the hardening of the artery are some things here that kind of portray or kind of lead this on. Somebody that's a diabetic that has diabetes, all right? Overeating of items such as eggs, cream, butter, animal fats, some of your dairy products there, okay? Infectious diseases, being overweight, excessive nerve strain, okay? It can be some hardening of the arteries. So the hardening of the artery wall may be caused by fibrous tissue in the blood vessel and by calcium or cholesterol deposits. So cholesterol deposits weaken the arterial wall, cause it to rupture easily for the hardening of the artery of the arteriosclerosis. Okay. All right. So we have Hayden in here. Hi, Hayden. So thank you for checking in as well too. If you have any questions, you can write your questions on the side chat there as well. All right. Moving on with another illness here is another circulatory illness is a stroke. Okay, also known as cerebrovascular damage. It is caused by the lack of blood flow to the part of the brain. Okay, and may be caused by a blood clot in in one of the arteries, or a rupture of the artery wall in the brain, which accompanies escape of the blood into the brain tissue. Okay, so stroke is another one that is leading to a cardiovascular illness or disease. Um, a stroke results in sudden death or permanent damage to the brain tissue. So it can be very traumatic. Somebody can die instantly from it, or it can have permanent damage overall. Okay, a patient who had a stroke may develop paralysis and on one or both sides of the body. So meaning that their body kind of becomes like kind of paralyzed, so they can't talk correctly. It might affect their speech. Their face might sag a little bit. So those could be some indications of somebody having a stroke. He or she may have difficulty with walking, eating, doing other daily activities, an ability to speak clearly. Sometimes their speak becomes kind of like hard to understand. So some symptoms are numbness of the face, limbs, and other body parts. Okay, parts of the body, unexplained dizziness, a sudden collapse for stroke, or some symptoms for that. Okay, any questions on strokes there? Okay, unfortunately, sorry to hear that, Beryl. I know that some of you guys could relate to some of these things, and some things I could relate to with personal situations and families. So I'm sorry to hear that about your grandma. Um, with having a stroke, that's very unfortunate because that affects a loved one in the family. So I understand that. So I understand a lot of you guys might have somebody that have had some of these symptoms or some of these illnesses, and it takes an effect to a family member, and I could relate to the same with some people in my family too. So thanks for sharing. Okay. Um, the next illness I'm going to talk about is called thrombosis. Now, thrombosis is a formation of a blood clot or thrombosis inside of a blood vessel, completely blocking the flow of blood throughout it. So, the chief cause of thrombosis are injuries to the inner lining of the blood vessel. So, this is another blood vessel like disease where it kind of affects the flow of blood in that blood vessel from a clot. Thrombosis is the name of this one. So it occurs when the veins develop a clot and becomes inflamed, and this occurs in the thighs or legs. So it usually affects more the legs and that part of the body, and it's actually pretty common in women, more so women than men, for thrombosis. So it is characterized by pain such as below the groin or tenderness, swelling of the muscles, and rise in body temperature as well. Okay, so those are some characteristics with thrombosis there. Okay, now I'm going to talk about some blood diseases next. So we talked about some blood um, artery illnesses within the arteries itself, and just some heart illnesses too. So this one's going to be more blood diseases since it's relating to the system that we're talking about. The first one I'm going to talk about is anemia. There's a couple different types of anemia. There's one called iron deficient anemia. There's called aplastic anemia, and you may have heard another one called sickle cell anemia. So I'm going to talk about these three types of anemias next, which are blood disorders. Okay. All right. So this is the next part. All right. Yeah, Vero, you could come in and check out anytime. You could always go back and watch these this podcast and stuff like that. So if you have another class around the same time, you may check out as well. So it's totally up to you on your schedule there too. So I'm usually on here between 8:30 and 9:30 during this time. Um, so yeah. Okay, moving on with the anemia here. The first one, like I was talking about, is iron deficient anemia. Iron is necessary for the body to make red blood cells. Remember, we talked about red blood cells, and they're like disc shaped. They're very numerous within our blood. Okay, there are three types of blood cells we talked about from on Monday: red blood cells, white blood cells, and platelets. Those were the three that kind of made up, within our blood. And then also plasma, which was not really a blood cell, but plasma is also the fourth type of component in our blood, okay, which was like 90% water and 10% salts and fats and acids with it. So low iron intake and loss of blood due to menstruation are the common cause for iron deficiency and anemia for this one. Okay. It is rare. It is a rare form of anemia for I'm sorry, that was iron deficiency. The next one I was talking about is aplastic anemia. There's like three types of anemia here, so I don't want to confuse you here. So the first one I was talking about is iron deficient. So they're the ones that help make the blood cells, the red blood cells. So the iron deficiency intake is a loss of blood. It's common, just called an iron deficiency anemia. There's not a whole lot on that one. The next one is called aplastic anemia, and it is a rare form of anemia that occurs when the body stops making enough red blood cells. So common causes are viral infections, exposure to toxic chemicals, drugs, autoimmune disease. Okay, so it is a term when the reason of low red blood cells production is not really known for the aplastic anemia. Okay, any questions so far? All right, just kind of checking back and forth. Okay, sickle cell anemia is the next one. This is an inherited anemia, which the hemoglobin protein is abnormal, causing the red blood cells to be rigid and clog the circulation because they're unable to flow through the vessels. So they actually look like a sickle, like a farming tool, kind of like shaped like a sharp edge. So they block a lot of. That's what they do. They clog circulation, so it's hard for someone to breathe or that blood to kind of get pumped through if somebody has sickle cell anemia. So this could be very dangerous and it can affect your breathing overall. Okay. All right, so those are some of the types of anemias. There's another one, vitamin deficient anemia. This is somebody that has low levels of vitamin, like vitamin B, like a folic acid, usually due to poor dietary intake. So that is another one that could affect maybe your gastric tract for digesting food and certain foods over time there too. Another illness is blood cancer. You probably have heard of that one as well. Blood cancer affects the production and function of your blood cells. So most of these cancers start in your bone marrow where the blood is produced. So stem cells in your bone marrow mature and develop into three types of blood cells. That's where I was talking about three types of blood cells: are red blood cells, white blood cells, and platelets. Okay, so some types of blood cancer, you may have heard of this one called leukemia, or you may know somebody had leukemia. Okay. All right. So hi, Carly. Thanks for checking in as well too. So if you have any questions, you may ask. I'm talking about circulatory illnesses and diseases right now for this part of your project to give you guys some ideas and background information on some circulatory illnesses. Now, leukemia is a blood cancer type of cancer found in your blood in bone marrow, and it's caused by a rapid production of abnormal white blood cells. So the number of high abnormal white blood cells are not able to fight infections, and they are impaired. They impair the ability of the bone marrow to produce red blood cells and platelets. So there's a couple different types of leukemias. There's one called acute lymphatic leukemia, chronic lymphatic leukemia. So those are a couple different kinds, specific kinds. So the symptoms may vary on the type of stages of leukemia, but they can include somebody having fevers, chills, night sweats, fatigue, weaknesses, swollen or bleeding gums, headaches, enlarged liver, spleen, swollen tonsils, bone pain, paleness, weight loss. Those are some indications of somebody having leukemia. Another blood illness or type of blood cancer is called lymphoma. So this is a type of blood cancer that affects the lymphatic system, which removes excess fluids from your body and produces immune cells. So lymphocytes are a type of white blood cell that fight infections. Remember the white blood cells, they help fight infections. We learned about that from Monday. So over time, these cancer cells impair your immune system, so they help fight against that. So some symptoms for lymphoma: swollen lymph nodes in the neck, armpits, groin area, fever, weakness, weight loss, sweating, difficulty breathing, itchy skin, rashes. Those would be considered some symptoms of someone having lymphoma. The next one here is called myeloma. Okay. All right. We got somebody else in here. Looks like Alex Tulix. Thanks for checking in, Alex. Okay. All right. Myeloma. This one is another type of blood cancer, and it specifically targets your plasma cells. Remember, we talked about plasma. Plasma are white white blood cells that produce disease infection-fighting antibodies in your body. So, myeloma cells prevent a normal production of antibodies, leaving your body's immune system weakened and susceptible to infection. This is a really rare type of cancer. Unfortunately, I had a family member that had this type of cancer, and it was a very sad situation, and a very close family member of mine having this blood cancer called myeloma. So actually, she was my aunt, and she was actually one of my inspirations to become a teacher. So she had this type of cancer. Unfortunately, she passed, and it's a really tough one to kind of go through just because it's so rare. She had to get all these different types of treatments and stem cell treatments along with bone marrow. So some signs and symptoms of myeloma are, they have excess calcium in the blood, anemia, renal drainage and failure, osteoporosis, bone pain, swelling, fracture, high protein levels, urine and blood, along with weight loss. Okay, so that is that one. Another type of blood disease is called hemophilia. It is hereditary blood disease characterized in inability of blood clot leading to hemorrhage or excessive bleeding from minor injuries. You just kind of bleed a lot. It's an insufficient lack of blood proteins from called clotting factors that participate in blood clotting causing the disease. Okay, so that is hemophilia. So how can we prevent some of these disorders? All right, so what do you think? Anyone want to take a guess here? How can we prevent some of these circulatory illnesses? I know some might be genetic or hereditary, but some can be prevented because somebody wants to write something in the chat bar. How can we prevent some circulatory illnesses? How can we prevent some of these circulatory illnesses? What are some ways that we could do prevent having a circulatory illness? What's one thing that you could think of you might do every day, especially when you're at school? Eat healthy, that's one. That's a great one there. Healthy eating there, Talon. Thanks for adding that in. What else? Don't spread germs. Yeah, of course. Thanks there, Alex. We don't want to spread germs either. But something else along with eating healthy, we call that diet, and something that you do physically. Anybody else have an idea? Stay active. Very good. Thanks, Kyle. Okay. I was going for exercise as well. Okay. So you guys staying active and exercising, these things could help prevent it. So exercise regular. Exercise improves blood circulation of the blood throughout the body. So it makes an individual less susceptible to a heart attack. Okay. Um, Eat a well-balanced and low-fat diet. Avoid eating fatty foods. So a high-fat diet increases the risk of heart disease. Eat plenty of fruits, vegetables, and fiber-rich crops. Okay, so those are some things like to focus more on fruits and vegetables. But it's good to have some protein in your diet. You just don't want to have too much overly fatty proteins in your diet. So stay away from high-fat foods. Even some of the dairy products, having too much of those have a lot of high fat products in there too. Okay, anything else on that? Okay, well, some other ways to help prevent circulatory illnesses would be living in a clean environment. Okay, that means do not play with chemicals or avoid staying in places with high radiation. Do not stay outside in the sun rays where it's super intense. Okay, especially here in Florida being super hot, that could eventually that could also have some effects on your circulatory. So it's good to be out in the sun, but just overly long, too long, could have a long-term effect with that. Or if you live in an area if there's pollution, you don't want to be in an area where there's a lot of pollution that'll affect your circulatory system. Some areas where I grew up in the Pittsburgh area, we had a lot of pollution because of the steel mills there. Now it's a little bit better, but still some of the air quality is not the best. So clean, it's not that clean an environment. So staying away from those types of areas. Okay. Avoid smoking cigarettes. Okay, staying with smokers or staying with smokers. So that means getting someone secondhand smoke. So smoking increases the risk of stroke and coronary heart disease. Stay away from smokers. Secondhand smoke inhalation is even more dangerous. And unfortunately, I had a family member that had secondhand smoke and passed from cancer that way. So that can affect your lungs overall. That was more respiratory, but it will affect your circulation as well too. Have a positive outlook on life. Be happy. Live peacefully with others. Stress and tension may cause heart failure and stroke. So living a positive lifestyle, less stress, less tension, those things could lead to heart failure and stroke. So those are some indications there how we could prevent some of these things. So let's talk about some treatments or cures of the circulatory disorders here. So the first one I mentioned was a congenital heart disease. All right, so how can we treat this? This heart defect can be treated successfully with surgeries, sometimes performed within a few weeks or a month from birth. So surgery could help that indication there. The next one I talked about was called angina pectoris, which was like the osteosclerosis, the thinning, the narrowing of the arteries. Rest and relaxation can offer relief from emotional stress. So that could be a way. It could be somebody can have a symptom for treatment there. Hypertension, somebody with high blood pressure. Okay, change in lifestyle. Eat more of a low salt diet instead of a high salt diet. A diet rich in fruits, vegetables, plant fibers, maintenance of ideal weight, and exercise. If you exercise, you manage your weight, eat healthy, that could lower your cholesterol, not cholesterol, your hypertension, your high blood pressure. Okay, all right. Other treatments and cures, angioplasty, okay, that is the technique for drugs there. It's a technique of mechanically widening or narrowing of the obstruction of the arteries, okay, and in the latter of results of somebody with osteosclerosis as well. So some drugs and angioplasty would be some ways to help that. Angioplasty with stents is a small expandable tube. It's permanently inserted in the artery. All right, and this keeps the arteries open. That's another way to kind of open those narrow arteries of somebody with angina pectoris there. All right, another procedure here for someone with heart disease is a surgical procedure performed to relieve the angina and reduce the risk of death from coronary artery disease as well too. So it kind of opens up those arteries, this coronary. All right, that is everything that I needed to say on the illnesses and types there. I'm going to be open right now for any questions and about your project or your brain pops. Okay, so if you don't have any questions, you may leave. There's only about a handful of people in here. It was up to about 12 or 13 earlier on, but I know there might be another Zoom kind of overlapping right now. So I'm just kind of here for questions, and I might, if I get some interaction, I could probably do some quizzes with you, or just kind of a question and answer. If you have any questions pertaining the circulatory system and or its illnesses. Okay, any other questions that we may have? Any questions on the circulatory system? As I mentioned, it transports nutrients, water, oxygen to our body cells. Okay, and it's a pretty amazing highway that travels throughout our body, connecting to all your body cells. So the circulatory system not only transfers blood, but nutrients, water, and oxygen. Remember, oxygen rich and oxygen poor. I put that down onto your Microsoft Teams as vocabulary. So knowing the difference between that, oxygen-rich blood, blood that travels to the body cells, has high oxygen content and low carbon dioxide content. Oxygen-poor blood is blood that travels away from the body cells, so they're low oxygen content and high carbon dioxide content. So those are the two types of blood. Okay. All right. We noted that the heart is the main organ, the center of the circulatory system that pumps blood all around the body. So some of the main parts of the heart, okay, the right side of the heart has oxygen-poor blood. The left side of the heart is oxygen-rich blood. This is just a little review from the other day. Um, the pericardium is a protective sac around the heart. It surrounds the heart. It's usually filled with fluid. The middle part of the heart is called the myocardium. Okay, that's probably one of the most important parts because it's the muscle of the heart and it's strong and thick. The other parts of the heart were the epicardium, the outer layer, and then the endocardium, the inner layer, which is thin and smooth, which stretches where the heart's pumped. Okay. Then we also learned about the right and left sides of the heart are separated by a septum or a wall. Septum means a wall separation. So think of the oxygen-rich blood and oxygen-poor blood from the right and left side. So each side of the septum have two chambers. The upper chamber receives the blood is the atrium. The lower chambers which pump out the blood are the ventricles, the right and left ventricles. So ventricles pump out, atrium receives or takes in the blood. Okay. All right, so the right and left, the upper, they have two chambers for the atria or atrium. Right and left are the upper chambers. The two ventricles, right and left ventricles, they're the lower chambers. Okay, and they both are separated. The atrium ventricles also have a septum or a wall between them as well too. Okay, so atrium collects blood that enters the heart. The ventricles pump out blood to the heart, out of the heart. Okay, and we also learned about valves. The valves between the atrium and ventricles are connected to the inner wall of the heart by tendons. Okay, they kind of hold them together kind of like muscles. All right, tendons kind of, when we learn the muscular system, we'll talk a little bit about tendons there too. The tendons allow the valves to open and hold the valve flaps in place. Okay, they actually to close the valve. So, and if it's open, they're straight up and down. If it's closed, kind of looks like a T or like a tent. So they keep them open and closed. So that's how the structure of the heart. So this prevents the valves from flipping and turning inside out as well too. Okay, so we learned a little bit about that on Monday, how that works with the heart valve. Okay, and then remember that a muscle tissue works by contracting, squeezing, and relaxing. So squeeze, relax, as one contraction there of the heart. Okay, so when the upper part of all parts of the heart work together in a repeated sequence. So when the two atria contract up top, the two ventricles relax at the bottom, and then vice versa. That contracts, that relaxes. So this is how blood moves throughout the heart and is pumped through the body. So one complete sequence or contraction and relaxation is called a heartbeat. So when it contract and relax, let go, that is one heartbeat. Okay. Then we learned about the types of blood vessels. So we learned about arteries carry blood away. Artery starts with the letter A. Think of the word away. Starts with the letter A as well. Carries it away from the heart. Capillaries, they link arteries and veins together, usually small, much smaller. And veins carry blood towards the heart. So veins towards the heart, arteries away. Capillaries link the two together. Okay. All right. Anybody else with any questions here? Just kind of reviewing some things that we talked about. All right. Questionnaire. It looks like you wrote something, Alex. You have a question, Alex? Okay, so going back to arteries, they are the larger of the large vessels. So they carry blood from the heart to tissues of the body, and they carry oxygen-rich blood, which with the exception of pulmonary arteries. So the thick walls need to withstand pressure produced when the heart pushes blood into them. Capillaries are the smallest blood vessels, and the walls are only 1 cell thick, and they're very narrow for capillaries, and they bring nutrients and oxygen to tissues, absorbing carbon dioxide and other wastes for capillaries. Okay? And veins, like I said, they carry the blood towards the heart. Once the blood has passed through the capillary system and it's returned to the heart, these are done by veins. So the walls contain connective tissue and smooth muscles. So the largest veins contain one-way valves that keep the blood flowing toward the heart. Okay. Then I talked about blood pressure, which I mentioned that today too. Okay, blood pressure within the heart with having a cuff, getting your arm pressure. The systolic is the upper number, the diastolic is the lower number. So 120/80 is a normal reading for somebody with a normal blood pressure reading. So when that number becomes higher than 120 or higher than 180, then someone has hypertension or high blood pressure, which we talked about as one of our illnesses or diseases within the arteries there. Okay. Um, Blood makes up about 8% of your body. Okay, total amount of blood in your body, about 8% is blood. About 4 to 6 liters that we contain in our body. So that's some facts on blood. There's 3 types of blood cells: red blood cells, white blood cells, and platelets, were some that we talked about from Monday. Plasma is another component of blood cells. So this composed of plasma and blood cells. So it's really like a fourth. It's like a separate group that's plasma. So it's like a beige or straw color. It's about 90% water. 10% of it is dissolved gases, salts, nutrients, enzymes, hormones, and wastes. Okay. So red blood cells, they're the most numerous. They transport oxygen. They're disc shaped. They're made in the red bone marrow as well. All right, so those are one of the most important ones. The white blood cells, they help fight against infections. They fight against parasites and attack bacteria. They have lymphocytes, produce antibodies for fighting pathogens, kind of like helps remember them. And there was another one called platelets. These help and aid for the body in clotting, for blood clotting. They're usually in small fragments. They stick to the edges of broken blood cells, and they secrete clotting factors to help them form clots. Okay. All right, and blood has 3 main functions, and those 3 main functions are to transport nutrients, like we mentioned, water, gases, blood throughout the body, and it also protects. Blood protects the body for protection, having some of those white blood cells for protection, and it helps regulate temperature, keep you at a normal body temperature and what they call homeostasis, normal levels. Okay. All right. Question there, Alex. Looks like you had something that you were going to say in there, but I'm not too sure. Okay, are there any other questions about the project? Project due Friday. 2 parts of the project: the diagram part, diagramming the heart, and highlighting the blood flow through the heart, like in red, having the arrows coming in through the heart towards it. All right, and in blue, the blood leaving through ventricles and so on to other arteries, and labeling the arteries, veins, and capillaries and other parts of the circulatory system. Okay, and then the second part is doing the research of a cardiovascular or circulatory like disease. It could be like ones we talked about: leukemia, it could be stroke, heart attack, um, hypertension, high blood pressure. These are talk about the symptoms. I labeled all this out on Microsoft Teams on what to include. Look on your Teams page, scroll up, find it on what to do and include, and then also do the brain pop 3 questions with the video and the vocab. Okay, I'll do Friday. Okay, there's only a couple people in here at this moment. Now's a chance if you have any questions to ask. Any other questions that you may have? And it's time to ask right now. Like I said, there's only 3 or 4 of you guys in here. Oh, okay, we got a question here. Good. All right, so Kylie Sosa, thanks for asking here. Do our model of the pulmonary through the body. Yeah, you could do it like that, Kylie. With your model, you could show the circuit of the pulmonary circuit as well. That's with the breathing, kind of showing where the blood flow is going through, and just show the pulmonary circuit. You could just do it within the heart. You could show it just within the heart, the colorations there. Or you could go showing other areas too. Okay? Either way, heart would be more than what I'm looking for because it's the main component of this project. Okay? Can you give me a thumbs up on that if you understand? If I answered your question there right. Okay, good. All right, you got that. Excellent. All right. Any other questions here? Any other questions pertaining to the project or any vocabulary? Um, I'm going to do a little question and answer right now. If you paid attention to some of the diseases I talked about today, um, um, we'll just kind of go through a couple of them here, see if you guys paid attention. Um, this is a type of circulatory illness where bulging occurs due to the weakening of the arterial walls. Okay, and anyone remember what the bulging of the arterial walls caused by injury or infection, what that type of illness may be? Has a hard time of getting blood, increased in blood pressure, which is usually something really sudden. I don't know if it's probably a hard one for you to remember. I went through a list of them. But that was an aneurysm there, so an aneurysm. Now that I know a lot of these have a lot of similar symptoms and similar treatments for them because they kind of relate to one another. But here's one that you probably should know. This is a type of illness, a cardiovascular illness. Um, if your blood pressure is higher than 120 and higher than 80, um, what would that be called? If it's measured. So if your blood pressure is higher than 120 on the systolic pressure and higher than 80 on a diastolic pressure, what is that called? And this is when the body's blood vessels narrow, causing the heart to pump harder than normal and push through the narrowed walls. So that's a pretty easy one. I think most of you guys should probably get that as a correct answer. Well, there's only about 2 of you guys in here, so I don't know who would be willing to participate on that answer, but if you are, you can write it in. If your blood pressure is higher than 120 on the systolic pressure and higher than 80 on the diastolic pressure. Well, that was hypertension was what I was looking for, or high blood pressure. So um, that's what that was there. All right, so there's only about 2 people in here. If I don't have any questions, I am going to end a little bit early um, for this session, and I'll be back on today at 1 o'clock as well for the last session for today. So make sure if you have any questions, check back in with me then, or email me, or send me a message on Microsoft Teams. So any one of those ways would work for me. Okay, we got Vicente. Hi, Vicente. Any questions before I sign off for today? Looks like you just checked in. Do you have any questions? I'll be back on at 1 o'clock if you don't have any questions at this moment, but time's now to ask before I end for today. Projects due Friday along with Brain Pop. Friday, Vicente. It's due Friday. Okay, any other questions? Okay, make sure you get that turned in. Yeah, you have a couple more days to get everything turned in, so don't waste all your time. Um, space out your lessons or space out your work throughout the week here. Any other questions you may have, Vicente? Do you know what you're going to do for a cardiovascular circulatory illness like stroke, hypertension, anemia? Just went over a bunch of them here. Heart failure, heart attack. You have an idea of which illness that you might be researching? Okay, heart attack, that would be considered one. I didn't really get into too much detail on heart attack today, but there's information on that too. It's kind of like related to stroke. Okay, all right. And then you know what to do with the diagram, right? Listen to draw a diagram of the heart. I wrote it on Microsoft Teams, the information for the project. So to diagram the heart, showing the flow of blood coming into the heart in red and flow of the blood going out in blue from the atrium and ventricles, and labeling the parts of the heart and arteries and veins and what they actually do. There's about 10 vocab words in there to label with your drawing. And then don't forget to do the brain pop and the quiz on brain pop too. Okay, got that? Excellent. All right, any other questions? Like I said, there's only a couple people in here. I am going to end early if there's no other questions. Okay, well, I will be back on at 1 o'clock this afternoon. So there's only a couple people in here. So check back in with me if you think of any other questions. I'll be presenting similar stuff that I'm talking about right now in case you missed, or you can go back and rewatch any of the first parts of this. Usually about the first 20-30 minutes is kind of me kind of talking about or presenting for the day. Okay? All right. Okay, well, I am going to sign off for right now. So thanks for tuning in. Like I said, I will be back in at 1 o'clock discussing the circulatory illnesses and diseases. All right, I'll see you guys later. Have a good rest of your day. All right, goodbye.